Now that we've covered some of the properties of sulfur, in my previous videos in this series, I've talked about the structural properties of sulfur and how important that is for your digestive system in terms of leakiness of the gut and motility. And I've talked about the antimicrobial, antibacterial, and antifungal impact of sulfur. So what I want to do now is take you through a few cases, and I think I'll divide these up into different sections so that we're probably going to have a series of different cases just because some of them get really complex. And I don't want to, overburden people. I want it to be easy for you to find what you're looking for. So I'm going to start with some success stories. Now, my patient population is very complex because I'm seeing people who have been through literally years and years of treatment and testing. And most people have taken some kind of antibiotic treatment and had SIBO tests, many SIBO tests sometimes, and maybe gotten a little bit of resolution from taking antibiotics afterwards. I mean, there are people that respond and, they're done, but the people that I see are the ones that have had test after test after SIBO test and treatment with Xifaxan, metronidazole, erythromycin, other antibiotics, motility treatments, antibiofilm treatments, and yet their symptoms continue to persist. So these are the type of cases that I'm going to be talking about. Here's a relatively simple one that I'm going to start with, although this particular man had been dealing with his symptoms for a long time, but once he got in to see me, we were able to get him some permanent resolution relatively quickly. So he came in, he's a 68-year-old man, and he had reported daily gas and bloating, which was painful since he was a teenager, so it's been 40 years of this. He had followed lots of different SIBO protocols with many different doctors and nutritionists and specialists. However, nothing really impacted any change in his symptoms. So he had taken prescription antibiotics and antifungals, pretty much all of them, and many different courses as well. So Xifaxan, at least 3 courses of Xifaxan, metronidazole, erythromycin, ketoconazole as an antifungal, itraconazole, nystatin, diflucan, and all of these are under the premise that there's something fermenting in the digestive system. It's either a bacteria or a fungus or both. And if you kill it, then you're going to resolve the problem. But obviously for him, that's not the case. I mean, something is fermenting because he's got gassy bloating, but they're not really accomplishing a permanent resolution for him. So there's more that his body needs in order to effect a change. Now, he also took supplements. He took digestive support supplements, like ox bile for the gallbladder, like pancreatic enzymes for pancreatic insufficiency, betaine hydrochloric acid for the stomach phase of digestion. He took biofilm busters. He took motility treatments. Again, no change in symptoms. He also tried diet changes. So he tried the low FODMAP diet, the SIBO diet, the Candida diet, elemental diet, and low sulfur diet. Now, when someone's on a low fermentation diet and yet their symptoms remain the same, that should be the clue that this is not just about one thing for this person. This person is probably deficient in sulfur and needs to go through this ramp-up course. So when I saw him, he'd had 40 years of treatment. He came in with a stack of SIBO tests and a long history and 40 years of diagnosis. And so we started him on the GI Janelle 1 formula right away. That's all he did. He didn't make any diet changes. He just started to titrate up, and he titrated up very quickly. I warned him that, some people experience some, ramp up, maybe intolerance type symptoms that resolve over time, but I prefer doing a slower ramp up because of that, or maybe some die-off reaction of species that are making you feel sick. But he just wanted to go full force ahead, and so I said, all right, let's follow up after you've been on the treatment, the full dose treatment. And so we followed up at about 4 weeks, and he reported to me that at week 3 of his full dose treatment of the GI Geno 1 powder, his symptoms stopped for the first time in 40 years. And then they resolved over the 8-week course of the GI Geno 1 powder, high-dose sulfur therapy, and that was over 5 years ago now, and his symptoms have never returned. So that's a pretty quick out-of-the-gate story for you about a really, really nice resolution for a person who struggled so long with these symptoms. He actually reminds me of me when I was initially doing this treatment for myself. So I will go on to some more cases in subsequent videos, and what I'm going to do is get into some really complex cases where we've had to do a few more things in the course of therapy to actually get my patients in a place where they are no longer symptomatic, no longer having these daily painful and life interfering symptoms.